At the Taco Man,
Hmm.
your boy Hector.
Oh, heck.
And what's her name?
All right. So thank you everyone for joining. We're going to go ahead and get started. Today our session is going to focus on strengthening collaboration between school-based health centers and school mental health teams. My name is Marwa Ahmad and I'm a community health system specialist with SBCSS. This is our fourth year in partnership with California School-Based Health Alliance, where we do these school-based health center webinars. And so I'm really excited to introduce our speakers today. We have Sang from California School-Based Health Alliance. Many of you guys may know her because she serves as a capacity building consultant, supporting school-based health efforts across the state, but specifically here in the Inland Empire. And we are also joined by RuPaul, a licensed clinical social worker and program manager at the Child and Family Guidance Center, who brings extensive experience in school mental health and community-based care. RuPaul has been with the Child and Family Guidance Center since 2006 and served as a program manager of the North Hills Wellness Center since its opening in 2015. In her role, she oversees the day-to-day operations of mental health services and provides clinical supervision to on-site teams. She is a passionate advocate for integrated care and firmly believes that collaboration and partnership are essential to effectively supporting our youth. Before I hand it over to Sang, I just wanted to go over a few housekeeping items. So if you have any questions, please feel free to add them in the chat at any time, or you can hold them at till the end of the presentation. And then we also have a feedback survey that we ask for you guys to fill out at the end of our session. Also, all slides and all tools that will be presented today in today's webinar will be available on our live binder, which we'll add in the chat at the end of our presentation. With that being said, I'm going to go ahead and hand it over to Sang.
Yeah, thank you, Mara. Let me go ahead and get us into slide mode. I know, I can't believe it's been 4 years since we've been doing this. And so I'm sure it's been like, I don't know, what, 13, 14, 15 maybe webinars. And we've gone through our table of contents and the Vision 2 Reality Tool Guide, I'm sure, and up and down. So yeah, thank you for the partnership with SPCSS. And it's nice to see a few familiar faces on this webinar as well. And so this is our second one for the, no, our first one for the year, right, Mara? I'm losing track already. No, yeah, our first one for the year. Um, when we came up with this topic, so let me back up and say it's been 19 years since I've been working in the field of school-based healthcare, and I have to say most of what I've learned were because I spent 15 years working in Los Angeles. And those 15 years, 10 were actually with LA Unified School Districts through the LA Trust, supporting all the work that was done there. And it's really where I learned so much, and really where I gain a lot of my knowledge and experience in school-based healthcare. And I actually worked with RuPaul, who's going to be the co-presenter here, many years ago. And so when I reached out to some of my former colleagues at this district about like who would be a really good sort of case study to really talk about, their work with districts, RuPaul's name came up. And so we reconnected and talked, and I'm just delighted that she decided to like, sure, I'll do this with you. And I think you'll find her experience working with the district and the work that they've been doing in her organization is really valuable, and I think will be a good template for you all to think about. As I know many school districts, and schools across the region. We have 33 school districts in San Bernardino County and then 23 in Riverside. So many are focused on addressing the behavioral health of our students. And so I just want to give that context about how much I love bringing the work of LA to this region, only because their school-based health center movement has been around for almost 40 years now. So okay, so this is us, and our contact information is at the end. Before I go any further, RuPaul, I don't know if you want to say anything else, or add to your intro.
Sure. Welcome and thanks for having me. I'm excited to be here today. As mentioned, my name is RuPaul. I'm an LCSW. My pronouns are she, her, and hers. I'm also a mother, a daughter, a wife, an educator, and a person of Asian Indian descent. And as mentioned in one of my professional roles, I am the program manager of Child and Family Guidance Center. So I will be speaking in a bit about kind of our journey with our wellness center.
Yeah, thank you. So I just want to start by just mentioning, for those of you who don't know, the work of the School-Based Health Alliance. We are one of the 49 state alliances in the country. And the work that we do is all about helping to put healthcare in schools, which is where students spend a good part of their day. And so this is really about a place-based initiative to bring healthcare services to our school campuses. And that's the work we do. We do that through technical assistance and policy advocacy and a lot of partnership work, including one here with SBCSS. We encourage you to become a member of our organization and the school-based healthcare movement. You get like discounts on registration, but I think the conference is the only thing where there's a charge, but pretty much everything else we do is free of charge, whether it's providing technical assistance or putting on different webinars and coalition meetings and things like that. So just want to plug in what I've been asked to do regularly in my organization. So I just want to, excuse me. I think we sort of know who's in the room, and we can see some of your organization's affiliations in there. But I want to get to this part, which is put in the chat. How much do you know about school-based health and wellness centers? Very little, some, or a lot. We just want to kind of get a sense of where people are. Let's see. Okay, see, Liz knows a lot. That's good. And we're seeing some. Okay, it looks like a lot of middle of the road, and that's good. That's good. Okay, so yeah, so just share that with us, and then let me continue on. Well, as I continue, I do want to these are learning objectives, which you probably already received when you got that information to register for this. But I wanted to start with just the naming itself, right? Like this is a series on school-based health center, wellness centers, and really the idea around school-based healthcare. And it's been around, the model itself has been around for, like I said, almost 40 years. LA having some of the first school-based health centers in the state and in the country. But really the last 10 years or so, we've seen a real proliferation of school-based health centers, wellness centers in California, of which there are now more than 400. But I want to say since the pandemic, we have seen so much interest and growth. A lot of that has to do with the explosive investments in, CYBHI behavioral health at the statewide level, as well as community schools coming on, a huge investment, both of those initiatives over $4 billion. And because of that, we were seeing a lot more initiatives happening at schools and schools creating these spaces to address health and wellness. And because of that, we've seen a lot of names that come up, whether it's a school-based health center or a wellness center, or in the case of LUSD, a well-being center. But we've also seen like care space, which I think is used a lot in Riverside County, calming corners. And that's great, right? I think having a range of models out there is great because it allows people to really help address student health and wellness, at a stage where they're ready, at a stage that, in a place where, they have the resources and also what works best for their audience. But I want to say that at the State Alliance, we really worked like for 6 months, or even more than that, to hone in on the definition of what a school-based health center is and a wellness center, only because, while we want to like sort of have this big tent, right, we do want to, I think, put it out there how we are defining school-based health and wellness, school-based health centers and wellness centers, using some elements of definitions that are put forth by what's in statute in the California State Legislature in terms of, the concept of school-based health centers, but also how it's defined by the federal government, namely HRSA. And so here for school-based health center, it's really services that are delivered, medical services are delivered by clinicians, but that can also include a range of other health services like behavioral health, dental, vision, other ancillary services. And then a wellness center is really focus on the clinical behavioral health services. Now, of course, there's also caveats to this, and I won't have time to go through all that today, but in Los Angeles, which is where Repulse is working, they're using wellness center as the nomenclature for really providing a comprehensive set of school-based health services that includes really behavioral health, medical, oral health, not for every places, but many of oral health. And so they're using that nomenclature wellness center really more as a population health strategy. And again, all of these are like nuances. But anyway, I just want to start this webinar off by just sort of naming that we're just seeing a diverse approach to this. And here we are with actual formal definitions of that. Okay, having said all that, let me move us on. One of the things I want to mention, and this is a tool that we have, is the Alliance came up with a sort of a 2-page tool on what makes school-based health center effective. And across this document are 5 domains, and these are the 5 domains here, right? Enhanced access to healthcare, stronger prevention, population health. It's providing the most intensive support for the highest need. Making sure that the work that is done really helps to improve the mission, the academic mission, and then really how can school-based health centers be integrated into the healthcare system? Today, and across these 5 domains, there are like sub elements of what this looks like. So for example, under this bar right here, this box right here, offering intensive support services for the high student needs, what that means are things like providing medical case management for all students as needed, or thinking about how we provide, collateral services, whether it's, helping with insurance enrollment or, helping to meet other basic needs. And then the last one out of that is really the school-based health center offering behavioral health services and psychosocial case management for students. And so for today, we really, when we bring on to Rapal to talk about her work at LUSD, we're really going to focus on what her agency is doing to address these two right here, enhancing access to healthcare, and then also providing the most intensive support for students. And the way we are thinking about this, this idea with, which is the title of this webinar, right? How to really have these strong partnerships with, school-based mental health teams and school-based health center is guided by school-based mental health guiding principles, which is actually out of the National Center for School-Based Mental Health out of the University of Maryland. And this has been developed a long time ago, but some of the principles have evolved and what have you, but they largely remain the same, right? In terms of like the way we're thinking about school-based mental health, whether it's conducting ongoing needs assessments, including a youth development component to that, the cost team, right? The coordination through a site team, that's like really a best practice. But the one that we are going to focus on today is this one right here, partnering with community providers. I always say that the work that schools do is really about delivering education, not necessarily healthcare, although, some schools really do embrace that and take that on. But we want schools to think about, when you want to do school-based mental health, please consider community partnerships. And the reason is because they specialize in this work, but also they can bring in the kind of resources that schools might not always have, whether it's because of financing or workforce piece, or just being able to, help lift, some of the burden that we know that a lot of schools have and really can't address on their own. And so I want to share an example of what this could look like. When we think about partnerships that meet the needs, all of you are familiar with this multi-tiered support system. This is just an example of what one model could look like. And so here would be where you would have your community partner staff really flip the triangle, right? Where they're focused more heavily on the tier 3, right? The targeted, more intensive interventions, and being able to, do some of the, sort of the heavier work. And then whereas for district staff or school staff, to really, again, focus on, the tier 1, right? The things that can really be delivered more of a population-wide approach, whether it's, social emotional learning or, helping to fight the stigma or what have you. And so this, so being able for a school to bring on community partners this is one approach, right? To be able to say, you know what, we really do have to address all three tiers, but how do we do it and how much effort do each one of us put into being able to address these three tiers? And so that brings me to RuPaul, but before I turn over to her, should I go ahead and play the video now then?
Sure, yes. I think this video
Yeah,
really
so we
introduces our
have
wellness
a
center.
yeah, we have a quick like 60-second video to introduce the Wellness Center at Monroe High School. We want to share with you before I turn over to her. So hopefully it plays. Can you guys hear?
Welcome to the North Hills Wellness Center.
Here at the Wellness Center, we provide primary, vision, dental, behavioral care, and much, much more.
Get free health resources to help you make informed decisions about your well-being.
Students can access individual, family, and group therapy at the Child and Family Guidance Center.
Services are available during the school days, in the afternoons and evenings. Services are also available on Saturdays.
Services are 100% student-driven.
Stop by and check it out. It's very convenient.
Make sure to call and make an appointment.
Oops, I don't want to play the end. Stop. Okay, there you go. Okay.
All right. So I love showing that video, and the students of Monroe High School were actually the ones who really took the lead with it. And I think it just gives you a good intro. And I was caught by what's saying said in terms of wellness centers versus school-based health centers. So just you will hear me throughout my time really talk about the North Hills Wellness Center as just that, a wellness center. Please know that per the definition saying outlined, we really are a much more comprehensive school-based healthcare center that incorporates all those other elements that saying mentioned. So just quickly to give you a sense of what I'll be talking a bit about today is sort of our reasoning as to why we've partnered with schools, how we have established our relationships with the school, how we have really integrated the healthcare center into the school, and then to talk a bit about successes, challenges, and the vision. So I think we're actually going to stop screen sharing. There'll be a couple things I share with you all, but I'm hoping this can be just a conversation. I'd love if people have questions as I'm talking to feel free to put them into the chat or just interrupt. Hoping to just give you a little bit of context as to our Wellness Center. So Child and Family Guidance Center for many years has co-located at schools with the understanding that schools are where children spend most of their time, right? And also where for many youth, struggles arise, and for others, a safe sanctuary where accessing support is possible. Our program in the San Fernando Valley services about 30 schools, one of which is Monroe High School in the North Hills community where the Wellness Center now exists. The model originally was to have therapists on campus, either a portion of or a full day, 1 or 2 times a week, with the hope that the provider would be able to meet with the student on campus. In reality, there were a lot of barriers to the system. Students were often truant or absent. Other times they were in the midst of receiving critical class material. So what I love and what I'll get to in a moment is you'll really hear about how the concept of a wellness center and that framework has really reduced and eliminated those barriers. So in addition to Child and Family Guidance Center providing school-based services, Valley Community Healthcare, which is a medical clinic, offered a small teen clinic on Monroe High School's campus for students to access sensitive services. So prior to 2015, when we opened, North Hills was identified as a community in need of additional support, and Monroe High School actually offered to house a wellness center on their campus. So CFGC and VCH, we both had pre-existing relationships with Monroe, so we sort of naturally and enthusiastically applied to be a part of this partnership and collaboration. And both agencies were selected. And so that's sort of how the North Hills Wellness Center started. We are actually at the edge of the campus. Monroe is a very large campus, and so we are on their property, but we are a standalone building at the edge of campus. And so there's 2 entities here. We really support whole person care, which includes primary care, sensitive services, optometry, dentistry, and then, of course, behavioral health. So like I mentioned, we opened in 2015, and I have been really fortunate to be here since we opened. And I'd like to speak to a moment for my why in this organization and this specific program. So when I learned that we would be entering into a partnership with the school and with primary care, I really felt like this is true integration. And I was someone who for years has experienced chronic migraines, and that impacted my high school experience to the extent that one year I had so many absences that I almost couldn't matriculate to the next grade. So I really see the value in being able to have youth address their medical and mental health needs while at school in order to ideally improve their academic and overall functioning. And as you likely know, the data really supports the idea that prioritizing children's health ultimately increases school attendance rates and subsequently leads to more productive and healthier young people. So it was sort of a no-brainer. Who could say no to that? So I will say some of the operational logistics had an ease when we opened because of that pre-existing relationship with both agencies and LAUSD. We, of course, did complete MOUs, and we really excitingly worked on the blueprint for the space. Like I mentioned, the North Hills Wellness Center is a little bit unique from other LAUSD wellness centers, primarily because of the space. Monroe had a surprising amount of unused real estate, which I know is very rare. And they really had kind of a parking lot size on which we were able to build a comprehensive and extensive wellness center. And then also that piece, it really is very comprehensive. So the fact that VCH offers the primary care and sensitive services, and then a really nice optometry department and a dentistry department. And we, again, CFGC offers really comprehensive mental health services. So I do think that the North Hills Wellness Center truly embodies wellness, and we've been fortunate to be able to really capture whole person care. So when we first began, and still to this day, the LA Trust has provided endless support in the collaboration and coordination. And then we've been really fortunate to have LAUSD organizational facilitators who have paved the way for the different organizations to connect and create systems of flow. So before I continue, just curious, any questions so far, any values that you feel like are really important as you think about partnership and collaboration in this model? All right, I will keep going. So I do want to talk a little bit about our outreach efforts and what it looks like for students to receive care at the Wellness Center. One reality that we still struggle with is that many students and staff do not know about the Wellness Center or all the services that we offer. So when we opened, we did a lot of outreach events. We were at registration week, we were at back to school night, any professional development meetings that we could attend, open house, really any event that the school would invite us to, we were at. And we still table at a lot of those events still. We also conducted ninth grade tours, and so we would coordinate with the health teachers for them to bring their classes to the Wellness Center. And by the end of the school year, really the entire ninth grade population would have been to the Wellness Center. Unfortunately, when COVID hit, we had to pause the tours for a long time. And so I do think there was a gap where for years, a lot of the youth, a lot of the staff, due to turnover, hadn't been to the Wellness Center, again, didn't really know all that we offered. But I am happy to note that last year we were able to resume the ninth grade tours. And we actually just completed the fall round. So we'll do them again in the spring. And again, by the end of this year, all the ninth graders will have been to the Wellness Center. When we opened, VCH also had a really robust outreach department. And so we were able to really creatively utilize social work interns that I would have, VCH outreach staff, Monroe Health teachers, and LA Trust adult allies. And we would all work really closely with the Student Advisory Board, who was meant to be a voice of the school to the Wellness Center, right? They were really meant to let us know this is what the students are struggling with on campus. This is what we need from you. So we would do lunchtime tabling events, whether it was aimed at suicide prevention, whether it was aimed at obesity. It was really kind of a partnership with the students to be able to provide the types of tabling events that they were interested in. This has shifted a bit over the years, but we still have a team who works with that student advisory group. They're now called the Wellness Youth Advocates. And they, again, continue to inform us as to the needs of the campus. So other ways that we've highlighted our services is through various flyers and brochures. We have a whole host. We have some that outline the different types of services we offer, like group therapy. And we also were really intentional in creating one that I included in the slides that's aimed at the youth, and that's really meant to speak to them as to why they might want to access the Wellness Center. So we'll show you that in just a moment. Let's see, in terms of referral protocols, I'm going to, of course, focus on CFGCs, but I do want to speak a little bit about Valley Community Health Cares, because I think the nuances of those differences are really key in understanding how complex it has been to have the school understand who we are and how the students access services, because it looks really different. So even though we're housed in one space, because it is two agencies and we offer different types of services, there's a lot of nuances in how the students access us. And like I mentioned, VCH offers a really wide range of services. So for their sensitive services that don't require parental consent, like STI testing and birth control, youth can access these services during the school day, also before and after. And if they want to connect with the teen clinic, they really go through the nurse on campus. So they get a nurse's pass, they visit the clinic in that way. There's young people who work at the teen clinic who are able to make sure that they receive the services they need. They get a pass to go back to class. And this is all done confidentially in terms of no phone call going home for a class absence. So of course, a huge concern has been when students access the Wellness Center during the day, is it impacting their attendance in class? Are families finding out about the young person accessing those services? So specifically for the teen clinic, because it is really aimed at sensitive services, and there's been a lot of work and effort to ensure that the student does not get marked as absent so that that phone call does not go home. And then other VCH services that do require parental consent, like sports physicals, immunizations, eye exams, dentist exams, all of that families can access by making VCH their medical home. So again, just to give you a little bit of context about how VCH services are accessed. And then a key distinction and one we really focus on is, again, teen clinic and sensitive services are through the school nurse, whereas CFGC services or mental health services are really via the psychiatric social workers. So we have a specific school-based referral form, and I will spend a couple minutes just kind of walking through the referral form and saying you want to go ahead and share screen for a minute.
Yeah, before though, I just want to, I think, commend you, RuPaul, because this is, having spent so many years in LUSD and working with you and other partners, I love that you're sharing like the strategies, right, around what partnerships look like and who does what. And there are things that everyone, pitches in. So like when you mentioned like the ninth grade tours, right, a lot of schools are doing that, right, in LA. And it's such a wonderful way to introduce students, to their school-based health center or wellness center when we are able to do something at the universal level, right? Because it helps reduce the stigma, but then also becomes part of like the curriculum for that particular, those classes or what have you. And I know that, it like, I'm not sure about at Monroe, but I know like at Hollywood High School and some of the other high schools within the LSU network, sometimes it's like it's a 2-hour thing where they're visiting like 4 or 5 different stations, plus they're getting universal screenings for some things too. Everyone gets, a social emotional screen or what have you. And so really being able to think about like, how can you, when you are partnering, how do you able to contribute to the outreach efforts, right? It's not just the job of the school nurse or, the school counselor, whomever. It's everyone who's there pitches in to be able to help lift some of these strategies. And I also love how you mentioned some of the other elements that we like to think of as like the best practice in school-based healthcare, having a youth advisory board, a student advisory board. I think in the case of Monroe, you're all so much more advanced in that you actually have as part of the workforce students, who are staffing the clinic, right? And that's such a beautiful model. And I know for some of you who are thinking about bringing in that CTE component to this work, it's such a beautiful model, right? You're able to actually have that experiential learning incorporated in that. And so just as you were going through all the different things, I was like, whoa, she's checking off all these different, best practices, that we're always promoting. And so I really appreciate that, RuPaul.
Right. Well, and even like the video, the students really like they wanted to script it. They wanted to kind of be the ones in the video. And of course, that makes so much sense, right? No one needs to see me or other adults in the video. So we have tried to be very intentional in terms of that framework. One thing that we didn't do with the tours in the fall that I'm actually hoping we can shift to doing in the spring is I would love for the students who are part of the youth advocate group to actually like take some role in leading the tours.
Yeah.
And I think there's actually a pretty new group of students this year. A lot of the kiddos who were part of that group graduated last year. So I know that we've been outreaching and kind of there's some new students that are part of it. So they also are learning the Wellness Center right now. But I do think even for them to lead the tours in the future would be much more effective than, the staff who works here for us to be the ones doing it.
Yeah, and and your wellness center, I remember when it was actually being built and planned, and part of it too was, supervisorial district money, to support that. But, your clinic has a waiting room for like community members, parents, family, and then there's a waiting room separate for students on the school side. And the students, I remember this, actually chose like the paint colors of the walls, and it's beautiful, like that green, blue, and they help, select furniture, right? I mean, talk about like ownership and also bringing in that youth voice, you know, to be able to really help them understand that this is for you. Please help decide what this should look like and what maybe resonates with young people, you know, so I love that. Okay, I'm gonna be quiet now and go back to screen sharing
Okay.
so I can help. That should be chiming in. Okay.
Oh, so this is just an example of the youth-friendly brochure that I mentioned. So when we are at tabling events, when we go to back to school night, we will include, we have this version, this one I just included is in English. We do have a version in Spanish as well. A lot of the population at Monroe does speak Spanish, so we have this translated in Spanish as well. And again, this one's more geared towards the youth themselves. And then we have a version that's a little bit more designed for the parents and the staff. So you'll see kind of what this one looks like. And we like to showcase our office space. When we opened, we weren't sure if students, it's a little bit of a walk from the campus over to our offices. And so we weren't sure if some students would prefer to just like sit on a bench at campus. But I think once they came and saw our office space and the couches and the games and the activities, almost all the students prefer to walk back to the Wellness Center and use the office space here. So that's the brochure. And then I did again want to spend a couple minutes just going through the referral form. So you'll see that there is contact information for both the person who's referring the student, and I am going to talk a little bit more about kind of how the flow works of that after we look through the referral form. But you will see that there's information tied to who is referring the student, and then also, of course, information tied to the student and the caregiver, and so how to reach them. A brief component as to why they are being referred, and a really important piece of the best time to reach the caregiver. Of course, one struggle we have with Monroe is that a lot of the youth want services, and sometimes it has been challenging to connect with the caregiver. So we try really hard to outreach to the caregivers as well. So that's the first portion of the referral form. And then this you'll see has a lot of detail on it. There's of course like the risk factor component. So we do ask that, of course, if any risk factors have come up, that the school has at least taken initial steps to address that. And this has not been a concern in the recent past because the psychiatric social workers are really the ones who funnel these referrals to us. Prior to their role at Monroe, we got referrals from deans and all sorts of staff at the school who weren't as familiar with, let's say, safety planning and things like that. So we include that on our referral form. And then we also include a whole host of symptoms and behaviors, whether it's tied to school functioning or home and community functioning. So you'll see, again, a really broad range. It's just meant to be check boxes that the referring person can mark off, just to give us a little bit of an idea as to kind of what we're expecting when that student does get referred to us. And of course, there's some space for families or the referring party to write in their own information as well. And then there's, of course, the informed consent component. So this is essentially just giving us permission to reach out to the family to do the initial intake. If and when families actually participate in the intake process, we do a much more detailed authorization or release of information for the ongoing communication and collaboration. This is really just for that initial contact for the school to say we're referring this family and giving our team permission to reach out to the family. And you'll see here just the version in English. Of course, again, there is a second page to this in Spanish for families who may need that. So I think saying we can actually stop screen sharing and I'll talk a little bit more about that piece. So like I mentioned, the Wellness Center didn't have psychiatric social workers when we opened. And so referrals first came from academic counselors, deans, support staff, teachers. It was anyone at Monroe would refer. And now at this point, Monroe has purchased PSWs. They have 2 full-time psychiatric social workers. And so they have really become our primary contact. And then on our side, in our admissions department, we have someone who's specifically assigned for the Monroe referrals. And we also have a school-based case manager. And she's the liaison between our admissions department and actually all of the schools that we partner with. So she's a really key person in terms of making sure the referrals flow well. The other person I think is important to mention is at Monroe, in the last couple of years, Monroe has become a community school. And so they have a really wonderful community school coordinator who's sort of become our administrative contact, which we were missing for a couple of years. So she has been a key person. And I do think, again, part of what makes the flow so smooth is having key people at each of these critical points. So I do think the PSWs and the community school coordinator at Monroe are the key people. And then at CFGC, that lead admission specialist, the school-based case manager, and myself, because we're really able to communicate when there's gaps, right? And there's always gaps. There's gaps like a family's phone number is no longer in service or the student's Medi-Cal has lapsed. And there's gaps like a young person clearly benefiting from services, but being really hesitant to seek care because of their immigration status. Gaps like new students and staff, like I mentioned earlier, not really having any awareness or familiarity of what the Wellness Center is. So our team works really hard to eradicate those gaps so that students can access care. And I did want to go back for a moment to, I know I spoke in the beginning about how traditional co-located school-based services had presented some barriers at Monroe. And so I do think one of the strengths of our Wellness Center is that we're on the school campus. Students can access care when they need it without disrupting their academics. How we currently do it, the model as it currently stands, is our providers will coordinate with families an ideal period for a student to miss. So right, not a class that they are failing, hopefully one that they are doing well in, perhaps an elective. The provider will walk over to campus to summons the student. And for us also, there's no impact on their attendance in that class. They're summons from the attendance office. They get a pass to miss class. We actually walk the student over to our office and walk them back because, of course, a lot of the students that we're working with may have some safety concerns in terms of suicidality. So a little bit, again, different from how they access teen clinic where they get the nurse's pass and they come over on their own. For Child and Family Guidance Center, once they're one of our clients, the providers do walk over and bring the student to and from the Wellness Center. And they don't need to miss class, right? So there's a lot of families who are really worried about the kiddos not doing well academically. A lot of students who don't want to be seen as accessing services during the school day, right? Like they don't want their peers or others to know about it. So what is also really nice is that we are here at the Wellness Center until 8 on Mondays and Wednesdays. We're here until 6 on Tuesday, Thursdays, and Fridays. And then every clinician who works at the Wellness Center actually works on Saturdays. And so we are here on site from 9 to 3. So the students and families have a lot of options in terms of coming during school, coming right after school, in the evenings for those kiddos that have some extra after school activities, and then also on Saturdays. So I do think that the traditional barriers to school-based services and that co-located model is really minimized when there is the Wellness Center or the school-based health center on their campus. In addition to the therapy services, all the clients who receive services can access additional care such as case management services, intensive behavior supportive services, psychiatric services, psychological testing. So the Wellness Center for us is actually sort of a satellite site for Child and Family Guidance Center. This is our smallest location in this area. And so we have offices very close by that offer kind of all of those adjunctive services. So that leads to me to just some of the successes that I wanted to highlight. And I know I talked a lot about the people, but to me, that really is the key. I think my team here, I think, is really phenomenal. We hire people who believe in the model of integrated care. And so they're deeply committed to youth and families. They're really passionate about the collaboration. I think each of the therapists here has the PSW's cell numbers on their cells, and they're texting and calling each other constantly about the students they work with together. And so again, the PSWs are really the gems on campus. I do think before Monroe had psychiatric social workers, it was much more difficult to collaborate in terms of the mental health services, but they have become our link. They're really fabulous at teasing out which students could benefit from the lower tiers of support, and then which ones need the more intensive services that CFGC can offer. I think I mentioned the community schools coordinator. When the Wellness Center opened, there was an assistant principal who was really excited about the Wellness Center. And so he was our administrative contact. He was the one who would ensure that we were at back to school night, at open house, at all the events. And when he retired, there was a real gap in terms of being able to find the leadership on campus to be able to make those connections with. And so I do think the community schools coordinator, right, by definition, part of her role is to build community. And so she has been so helpful in these last couple of years for us to do things like to restart the tours. I don't think without her partnership, we would have been able to make that happen. And I will speak again to just all the support we've gotten from the LA Trust as well as LAUSD organizational facilitators. there's a lot of pieces that need to be coordinated. And so I think they have helped us foster dialogue, problem solve when needed, and really help elevate the student voice. The piece I have loved about the LA Trust is having the adult allies who work really closely with the students and make sure that we aren't losing sight of what we're doing here in terms of really helping the students succeed. I also want to talk about some challenges. I do think that one piece that I have noticed is just limited resources. So I think I've mentioned once or twice that I've had interns that have played a really critical role. So we tend to have social work interns who work with the student group. There have been some years I haven't had interns, and so our ability to participate in the extent I would want hasn't been able to be there. And then another big loss, when we did open again, VCH had this really robust outreach team, and they would take the lead with a lot of the tabling events. Their main staff had like a DJ background, and so he would bring this life to the events at Monroe that really attracted a lot of the students to come to the tabling events. And then, of course, COVID happened and that entire department was dismantled. And so now VCH actually has very little in terms of resources that they can contribute to things like tabling events. So I do think limited resources is just kind of an ongoing struggle. And then the other struggle I will speak to is just differing levels of commitment to partnership. So I do feel like, I'm really confident in saying that CFGC and myself that we're passionate about the idea that the Wellness Center is here to serve the school and the community. And so every decision we make is really rooted in that belief. And I can say that that is the same across all the partners that are involved. I don't know that everyone has that same vision. And that is the vision, right? The vision is really, I think, to ensure that every student, every staff knows about the school-based health center here, knows what we offer, knows how to access us. Again, it is a little bit nuanced, it is a little bit confusing. And so my hope and aim is that people feel comfortable accessing care, they become more knowledgeable and confident in terms of how to do that. So that we can meet the needs and the demands. Because I do think, especially now more than ever, I think families are really stressed. I think young people are really struggling. And that, of course, impacts their ability to learn and flourish. And so, I do think the vision of our Wellness Center is to give students a space to be able to address some of those struggles so that they can flourish, their families can heal, their communities can thrive. So that's my piece. I would love to, people have questions, curiosities, experiences they'd like to share. I'm not sure, saying if you wanted to pop in the polls or the feedback.
Actually, let's do the polls first. I mean, actually, not the poll, the Menti. I guess it is
Okay.
the poll. Yeah, go ahead, Mara. Yeah, and then we'll go back to questions and then we'll wrap up. We want to hear from you now.
So go ahead and please scan the QR code that you see on the screen, and then you'll be able to answer the question through your device.
There's some good ones here.
Yeah, and some overlap for sure.
And these are all pretty easy, right, RuPaul?
Yes. Super simple.
Yeah. Yeah, I mean, this is a great list, and I think one of the things we can certainly do when we go back to our desk and think about our own work is, do some of these or some of these things happening, right? In our coordination efforts with other partners or even just within our own team. Mara, I don't know if you want to move us along or give another half minute.
Yeah, we can go ahead and go to the next mentee.
Okay.
I know that it gives you like three for you guys to put 3 different words, but you don't have to if you just feel like there's only one.
I appreciate that someone put support from upper admin, because I will say for certainty the years in between that assistant principal I referenced and the community schools coordinator, there was a real gap. We weren't at all the events those few years, and because we didn't necessarily have that support. So I do think that that's a really key piece.
But I love though, Rapal, how you said the community schools coordinator really stepped in. And I know a lot of schools, you're part of the grantee ecosystem, right? Where you're working on your community schools initiative and just thinking about the 4 pillars, right, of community schools. I mean, I integrated support services. I mean, that's so key. And so yeah, so tap into the folks who are working on that because they already sold right on the idea that it does take a community to serve our students. And so I love how you were mentioning that, Rapal, where when the vice principal left, that you were able to get the support, and that can make a huge difference, right? Whether you're able to participate in the 9th grade tours, or back to school night, or whatever else is happening, right? When schools are doing events, one good proxy is our partner agencies invited.
Right. Well, and I also appreciate seeing like the uncertainty, the politics, the medical system trust. I do know one piece I didn't elaborate on a lot today is just seeing how much the current climate is impacting people accessing care and services. And so it is November, and I have clinicians with openings for cases at Monroe, and that never happens. Like come November, we are full because the school has referred so many students to the point that we are like past capacity. And so we are absolutely seeing the impact of what is happening right now. And I think that's actually giving us opportunity to partner more closely with that student group and to really think creatively around, okay, how can we be more of a presence on campus? How can it be that, maybe students aren't accessing us in the traditional way of becoming a client and coming and seeing a therapist each week, but maybe we're doing informal, just little booths on campus where they can come and ask questions or where we have information. Because I do think as much as we can try to reassure families, the reality is we can't reassure them of all their concerns right now. And a lot of families are hesitant to seek care. So I can imagine that being a concern.
Yeah, I think that word uncertainty captures it all. I think Mara, we can go ahead and stop the yeah, thank you, Mara, for just handling that tech piece. Questions. What questions do you have for us? We just want to, and or if we don't, then we want to hear sort of where your efforts are. Did some of this make sense? Are you already doing some of this? Lauren.
Hi there. So we're working with 2 schools right now where we have the behavior de-escalation support, but we're looking to bring in the medical support, and we're talking to Hazel Health and just trying to figure out the best ways to partner with medical providers to add some additional layers of support. And a lot of them that seem really great. And we're looking to do that, but I know that a lot of them do require upfront costs per student. Have you found any ways to partner with any medical agencies, whether it be optometry, dental, or medical, where maybe it does, because it's a bulk payment, and we are fortunate to have some community schools and to have that funding, and we're definitely willing to do that. But just some of our non-community schools, they're like, how do we get these services, and trying to be creative and maybe
Yeah,
partner.
Lauren, what district are you with?
I'm with
or
Ucaipa
school?
Mesa.
Okay, got it.
Mhm.
RuPaul, do you want to answer and then I can
I'm
tag
sure.
team?
I mean, again, our wellness center, I think, is really unique. I know when we have people come and tour, like the dentistry, the optometry is not common even in the other LA wellness centers. I do think that those services have been really challenging to access. And I think because we do have it here, what ends up happening, unfortunately, for our community is that for families to access those services, right, they need to make VCH their medical home. A lot of them have pre-existing relationships with other providers, and so they don't want to switch. And so, like, we recently, I know, LAUSD and the LA Trust partnered to bring like a vision fair to Monroe, not tied to our provider here. And there was a lot of politics, as was mentioned on that last slide, around sort of that challenge of having a provider here and then bringing on another provider. But the provider here in reality doesn't service the students to the degree that I think the school would hope for, because it isn't really, they're not necessarily here just for the students. We're both community-based agencies. And again, I do think for CFGC, we are serving the Monroe community, but I think the medical clinic is trying to make sure, right, they're getting enough patients through the door. And so that isn't necessarily happening through Monroe. So I do think the challenge is certainly there. I'm not sure, saying if you want to add to that.
Yeah, I think from the California School-Based Health Alliance standpoint, we actually don't think that's like a best practice when schools are like asked to pay up front, right? And I think that's why we want you to explore other partnerships where like community health center partnerships type of, collaborations, because that's a big ask, right? And for some communities perhaps telehealth and telemedicine may work, but we really want people to explore partnerships through community centers and perhaps even through mobile units, because we've seen a few models where that is being used, and they're not getting the kind of utilization or really the bang for their buck for that. And so, Lauren, I can touch base with you offline about thinking about perhaps connecting with Kaiser, the Community Clinic Association, where they can think about who might be a good partner within like your geographic area. Yeah.
Thank you both. I appreciate it.
I think Cami, you have your hand up. Hi, Cami. Nice to see you.
Hi, Sang. Hi. RuPaul, thank you so much for sharing that. That's very helpful to hear. I'm at Silver Valley Unified School District, and we're out past Barstow, very rural, very different demographic than you're providing. However, we are any day opening our school-based health center, waiting on a cement parking lot and what have you right now. Anyway, brand new for this area. What we've come across in our learning is very much one in-person provider can provide in the building, right, for using your NPI number and all of that. But I was listening to you talk about two providers, and I wasn't sure if it meant at two clinics.
Yeah, so it's two completely different agencies. Yes.
That would make more sense for billing. Okay.
Yeah, so there's two separate agreements, right? So Child and Family Guidance Center, we have our agreement with the school district, and then Valley Community Healthcare has their agreement with the school district. It is wildly confusing. It's confusing to everybody involved, because again, it is two really different agencies. And CFGC, almost all of our billing is through Medi-Cal, and so we only see families with Medi-Cal, whereas Valley Community Healthcare sees a lot of families with Medi-Cal, but then also has some other funding.
Right.
So it is really complex. Yeah, and they do
different school. I'm sorry, different buildings, correct? Different buildings.
No, it's one building.
Okay, So I would like more information on how you do that with the CMS guidelines regarding that, because we have lots of partners out here, which has been so fantastic. And we're working on the demand, of course, because we don't have it up and going yet. And the questions are around only one in-person partner at a time in the building billing through that. So anyway.
Yeah, I would love to. Yeah, I know Sang's going to share our contact information, so I'd be happy to talk.
Sang and I
Yeah,
were-
and
we're
Tammy,
good.
it's a common model throughout Los Angeles where I spent most of my career. We actually, like Washington Prep, you probably know this, Paul, they actually have 2 mental health agencies and an FQHC partner all under the same building, which is like 2,200 square feet, maybe.
So we're gonna have that already. And this doesn't need to be the Silver Valley question and answer, but we're already having that. We have the behavioral health coming in that's going to serve, but they bill out of their main office, which is not there. We have a dentist coming in. He's a mobile dentistry unit. He'll bill out of his mobile dentistry. So there's that. We realized that we want a medical provider to come in and provide in our space because we have, and we're so excited and it's shiny and beautiful. And there was concern about this billing component and not being in the same spot. So any update would be ideal. Saying so we can connect. But RuPaul, thank you for your great presentation. So helpful to hear.
Oh, you're so welcome and congratulations. Good luck.
We've got like a minute and a half of Paul. Do you want to address the question on I think from Alicia about the CYBHI into your support system?
What was the question? Sorry.
Oh, sorry, it's in the chat. I'm assuming, Alicia, you're talking about the fee schedule, right?
Yes, that's correct.
We haven't yet. So for us, when we did open, we actually, all of our billing was through one of our larger sort of sister sites. But then we did go through Medi-Cal certification for the wellness center. So we do all of our own billing and everything through this particular site, which that took a few years when we opened. So when we opened, it definitely looked different than what it looks like now. But we just got like recertified for Medi-Cal in the last, I think, few months.
Yeah, let me actually answer your question, Alicia, by going back to the screen share, because I'm gonna wrap this up by letting you all know that let me see, how do I get to the next? Resources. We have our Vision Rally Toolkit, which I think many of you know, but here is what I want to say. The Inland Empire School Health Coalition, we also have a podcast program, and Alicia, our latest episode is actually on CYBHI fee schedule and how Harupa Unified School District is actually drawing down on that with their wellness coaching and how that work that they're doing is actually improving attendance. And so you can access this podcast program. Mara, I'm sure you have the link somewhere. This is out of your home base. Here we partner with you guys on producing this podcast, but it's a great episode in learning about how they are really drawing down on the fee schedule and being very creative about it, and getting a whole host of funds, reimbursable funds. Okay, so I'm going to wrap us up by also mentioning that our School Health Coalition, we actually have our next meeting December 4th, and we can get the information out when in the live binder as well, or in the follow-up email that I'm sure Mara and her team will send out after this. And our school-based health center conference is next April in Los Angeles. And then the last slide has the contact information for the both of us, for Paul and myself. Okay, I'm going to stop screen sharing and have Mara take us out.
All right, thank you everyone for joining us. Thank you, Sang. Thank you, RuPaul. If you guys have any questions, I will send out an email with Sang's contact information and RuPaul's contact information, so you can reach out to them directly. In the chat, I did put the feedback survey. If you can go ahead and take some time to just complete it, it helps us with planning our next webinar. And speaking of our next webinar, it will be on February 12th with Sang, and we're going to be focused on family engagement and what that looks like in a school-based health center. So I will send out the flyer when I send out the follow-up email with the live binder, all the resources and tools that we talked about, the podcast. And then, yeah, if you guys have any questions, please feel free to connect with Sang and RuPaul. If you have any questions for the SBCSS team, Alex, myself, and Karen are here to support you guys. But thank you.
Thank you all.